Hi, this is Vanessa Levin. This is my channel about the mental health field and related topics. So, not fun video topic today. It's about how therapists are traumatized through their careers. And I know that there's like this kind of like it's it's meant to demean us in like these different circles where people are like, "Ugh, you therapists, you all need therapists." Like, yeah, because the field traumatizes us. Like, there's just so much shit that happens that it's really like, okay. Like, I'm not trying to traumatize you back. I'm just trying to tell you a story of things that have actually happened to me that were often, well, actually, let's not say often, they were fully dismissed. Fully dismissed. So those 2.5 years that I worked at the psych hospital, awful. Not because of the clients, because of like staff bullshit, you know? And like there were things that happened there that I'm like, yeah, that was not good, but like wasn't traumatizing, you know. One two of the ladies dated the same person. Okay, sure. You know, like the staff dated each other, like kind of a lot, and not a thing for me. Did not want no to go there, because like even the people who were interested in me were trying to make sure that I felt powerless in front of patients, which is like, why would I want to get involved with you if you're already putting me down? Yeah, so no. Mm-mm. Yeah. And like arguing with me as to whether or not I was available to date while my while patients were in earshot. Why would I want to? I'm not. I really not available to you particularly. Yeah. But those aren't the traumatizing things. That's just a man. You're an asshole. Okay, this isn't happening. This isn't happening. I'm good. you you don't have to you don't have to go where you're going. You're just digging that hole deeper. But things like I mean, I don't, oh god, I don't want to, like, I do, I never wanted to learn how to like participate in holding people down during their worst fucking time of their life. Like, why would anyone feel any sort of pressure, like a pleasantry out of holding someone down while they're struggling? You know, like, that's not what I want to do. And like I did not have the muscle that I have now, and so I was a very weakling. Like, so I don't want to hold people down. I can't hold people down. This isn't for me. And also, I mean, like, trying to convince people, again, who are having the worst time of their fucking life, you know, to like calm down, or they're getting an injection. I also skeeved out by needles going into skin. I nope, can't do it, hate it. No, no, mm-mm. Not for me. Please don't, not in front of me. Oh god, not in front of me. I am not good with giving blood, just by the way. I always have to look away. Luckily, my veins are very easy to find. Um, but, oh my god. I, like, I have an existential crisis every time I have to give blood, because I'm like, there's a boundary between me and the rest of the world, and you are piercing that boundary, and it freaks me out. And like, also with the needles too, just I can't just medicine in, but I don't, nope, I hate it. I hate looking at it. Oof, no. So yeah, and all of that is very interesting and weird technology to me. um yeah. So, I think I've talked about this before. I don't know if the video is still up because I did private a lot of videos. I have my moments where I'm like, fuck this. I don't want anyone to, no one should listen to me. Never mind. So one of them was that there was a known violent patient who was admitted, and we don't know how any of that happened. Like, that was the administration saying that to us. He caused a lot of problems. He injured at least 3 of my coworkers, and one of them had already been injured by a different patient at a different time. It's like one of these things where it's like someone had a delusion and they started fighting, like physically fighting with someone, and my coworker was like standing, and there was a couch behind him, and he was pushed over the couch, so he did hit his head. He was fine overall, but like it was it's one of those things where it's like it's calculated because there weren't enough staff members on site, so there wasn't a lot of help to calm down 2 people, one of them with a delusion, that things were different than they were, like in, the consensus of reality. It's not like it's not it's not a good feeling when it's like this person did this almost on purpose to make sure that whatever was going to happen was going to happen in the most violent way, almost like calculated. It was calculated, as much as like I want to be like, well, he had he had the delusion, but he also was smart enough to know that like he could get away with a lot of things before, and it was 2 adult men who probably weighed at least, let's say 180, probably north of that, but like let's say 180. I'm no use. I'm of no use. Like watching all of that. Again, did not have muscles. So this just half the size. And I'm not, trying to push, anyone down. I don't want to, and having people tussle with each other and, physically fight with each other is not fun. It's not. I've never been to a boxing match. I haven't even been to a boxing gym. Like I feel like shit if I have to go to the gym and, hit the bag a couple of times because I'm just frustrated with other things. One of the worst things that happened, and there were a lot of things. There were a lot of things that happened in that 2.5 years. One time I got into a car accident. I spun out and hit the center divide during a snowstorm and still went into work. It was a weekend. It's almost like I didn't have any other option. And by the time I got to work, I was like calm. But shouldn't have been at work after an accident. But I was. As I was saying, one of the worst, aside from the known violent patient who knocked out one of my coworkers during visiting hours. So I walked onto, the wing and found my coworker with one of my other coworkers just laying on the floor, blinking. Like, good that there were signs of life, but he wasn't getting up quickly. No resources for that. No, hey, there might be, like a therapist we can call to like come make sure you're okay, have a couple of sessions, we'll pay for it. Never. That was never a thing. Never. And the other thing was that before I got to one of my shifts on a weekend, one of my coworkers who had diabetes and was working overtime like a lot had passed away. People who worked with this coworker were obviously upset, but they couldn't really take the time off. They needed the money. So some of them came in looking very shocked and emotionless and numb, which is not safe for anyone, including them, including the patients. But again, no therapeutic anything was offered to even the people who witnessed him at work pass away. There were no services offered. There were no services offered. The hospital did not care. They didn't even care enough to leave a memorial poster up that the kids made for him. They didn't care enough to be tactful with telling the patients that this coworker, this worker had passed away. They were like, yeah, he's dead. And this group of kids did not like me. So they were targeting some of their anger at me, which I know it's not personal. It's not like they just experienced something very obviously traumatic while they're in a hospital dealing with their other fucking traumas. If they're a little mad at me, okay, take it out, I guess. But also, could there be an acknowledgement that this happened and that it sucked and that I shouldn't have been the target of anyone's anything, But if it was gonna happen, okay, but acknowledge that it's happening. Nothing happened. Nothing. And then you have these asshole other therapists who are like, why are you even in this field? Why, making veiled threats about I could have your license if I want to, you don't need to practice, all of this other shit while trying to work, and it sucks. And then I have lost complete faith in DCF in Connecticut. So that's the Department of Children and Families. So I've worked on a couple of cases with them. They handled a couple of cases just fine. They've dropped the ball so many times that I'm just like, okay, this is not right. On one case, they had 4 different spellings for this person's name, which that's not cool. For another one, they changed the law so that if you had a foster child, because it makes it look better for the numbers and then they don't have to pay out as much, it made it look like they made a law that said that you can have a foster child for a year, and within that year you have to decide whether or not you're going to adopt this child. If you decide not to adopt this child, they go to another foster home, and that family gets to decide within a year whether or not they want to adopt that child. That's if the parents are not fighting for them. If the parents are fighting for them, you have a little bit more time to decide that, but you might really just be the foster home for that, foster kid. I don't think that this is fair for foster kids. There are so many statistics, and those statistics have been around for a long fucking time, about moving homes and moving schools makes it disruptive to your education, and you lose 6 months. I mean, for me, for my work, it will make any symptoms of ADHD, especially at a young age, start to get worse because the inconsistency. It's part of if you look at the DSM-5, it says as a part of the contributing factors to ADHD are multiple homes. like moving multiple places. And my clients who weren't even in the foster care system but were a part of other things, like, oh, mom didn't have enough money to pay to like house us and, you know, pay the rent or whatever, so we lived with aunt, and then we lived with grandma, and then we lived with grandpa, and then we lived with uncle. And like it just it there's something in that that is like a factor to ADHD. Yeah, and I mean just a lot of other things too. You know, so like I've just lost faith in them. And some of the people who I've worked with within Connecticut DCF just end up not liking me. They don't ask me questions directly. It's very like gaslighty, where they're like, "Oh, well, we didn't know if you could deal with addiction." I've done an internship with inpatient addiction. I do know addiction. I can help. Also, 2.5 years at the psych hospital, did plenty of, you know, of relapse prevention and, you know, encouraging AA, because there were AA meetings that would take place at night and on the weekends, you know, in the psych hospital. Like, the volunteers would come to the hospital, so yay. But like, you know, like, how are you gonna like not ask me a question and just assume that I don't know that I don't know anything? Yeah, and like, the last time that I had to like sit in on a meeting, and I was like, well, you know, I have to bow out, like I can't see my client. They were like, well, make sure that the next therapist is trauma informed, and everyone's like, Vanessa's trauma informed. You know, but they just kept on assuming that I don't know, that I was like 2 or 3 years into my into my license or something. Like, no, no, no. So yeah, that was like, I've lost faith. They basically told my client that they can't call the partner, the now ex-partner who's not around anymore, but that when they were dating at the time, can't call their partner any like names outside their name. Which I'm like, I don't think that you can tell any parent not to call the other parent a name if they want to. I mean, how many parents do you know that call each other jerks or assholes or sluts or, you know, whatever, as a joke? You know, that you as the state should not be telling someone, hey, you can't call someone an asshole after you've had an argument. Like, okay. That seems just overstretching, you know? Like, I don't think that it should happen every day. I'm not saying that, you know, I'm not saying that in all cases it's acceptable, but it's like, you all. The literal sentence was, that just doesn't sit right with me. I don't give a fuck what sits right with you. Like, if some parent has an argument, is like, jerk, afterward, just because, you know, you're trying to get some like anger out or whatever, you know, like, it sucks, you know, like, it's, you can't tell someone that, like, you can't tell someone, that's inappropriate, like, we can take your kid away. No. No. You all have other better things to do and deal with. Yeah. So it does seem like DCF steals children and wants to dictate from a very like institutionalized way to tell people how to raise their kids. And like, there's a lot of in between in that, where like, yeah, there are definitely bad parents, like, no doubt, especially in Connecticut, we've seen it. You know, like, there's been a lot of shit where I'm like, y'all. But between ultra bad and extremely good, there's a whole lot of crap in between. You know, like, um, do you give, like, is DCF going to take your kid away because you gave them a device at age 3 instead of at recommended age 10? You know, like, all of these things. Oh, and they were unsupervised, but, like, you know, these things where it's like, that's just a decision that parents make. You know, like, no, like, this is not, how far are we reaching here? You know, yeah, how far are we reaching? But yeah, that has, like, just really been, it's so, like, I have never worked on a case where there has been no direction completely at all. Like, there's nothing, there's no, this is how we want you to get better. It's, well, we don't approve of this. Okay, what's the answer then? Well, we're not telling you that you have to do this, but you do have to do it. Okay, so it's not an option, it's a requirement. Well, it's a recommendation from us. Okay, but if I don't do your recommendation, the kid is going to be is going to be kept away. Like, am I going to lose visitation? What's going to go on? And they, ugh, just, and, like, every time I'm like, yeah, we've had no direction for 2 years. They're like, well, there was an incident. I'm like, don't fucking tell me, like, that you're, like, judging my client still on something that happened 2 years ago with someone who is not their partner anymore. What do you want? What do you want? And they can't say anything. They don't know. They don't know. They just don't want me. They don't want my client to have their kid. And it is so frustrating to just be like, tell me what you want. Just write it out. Just say what the requirements are. Say the recommendations. And they can't. And I've never had this experience with the other DCF stuff. Oh, this parent has to take anger management classes. Oh, you know, like, you need to go to victim services. You need to talk to people. You need to make sure that you have a, you know, session every week with Vanessa. And I'm not involved with contacting DCF or victim services. Like, we're fine. I write a letter. We're all good. You know, like, I do not have to have this very, you know, intense involvement all the time to try and get my client's kid back and out of DCF care. Like, oh my God. And it's like, my client's fine. My client, like, outside of anything stressful from DCF, my client's fine. My client's fine. And that's the most frustrating thing, because it's like, my client, even in the moment that, like, everything was, like, unraveling and not being very good, and, like, I do have a video on this that eventually will come out, but, like, I don't feel safe right now expressing the whole story, which my client has told me, I can tell, I don't feel safe taking. Like, I'm not taking that route, okay? So, everything that led up to incident where, like, DCF felt like they had to step in for this kid, like, my client was making the right decisions. Once I release the video, I think you'll understand a little bit better, but my client made all the right decisions. And I think if I were in the same position, I would have made the same choices. So, you know, like, I don't think that it was not an incident that I felt like needed the extreme 2 years of DCF involvement. You know, that's it, you know. But yeah, that's a whole, that client is so willing, so ready. She's like, let me come up, let me come on. I want to tell my story. I want you to tell your story. I want, like, we're fine. We're fine. Like, I can't. she's a lovely person. I have admiration for all my clients. And like my clients, I mean, except for like the ones that occasionally catch me on the wrong day, and like 5 of my clients have like rescheduled or canceled, and I'm just like, why me? Like, other than that, like, and it's not even them, it's me. Like, I'm like, they're all good, they're fine. Like, I just have moments of being like, there's a cancellation, I'm not gonna do it. Until like, do you all hate me? Am I just doing terribly? No, I'm fine. Okay. It's fine. Yeah. It happens occasionally. But yeah, it just catches me wrong sometimes. But like, again, not their fault. Nothing, like, they're not doing anything. So, whatchamacallit, yeah, like, there's just, it's the system of like being a therapist that really requires a therapist to seek therapy for themselves, because like this sucks. Like, again, my clients are awesome, they're wonderful. It's fighting with insurances and DCF and like other therapists, and then like there's shit like, I completed all my coursework in a December, like, what is that called, semester. I had one semester I didn't pay for anything, like I didn't pay for tuition, I wasn't there, like, and but I graduated officially in May, and I totally forgot about this because like everything had been done in December, like, and there was a lot of things happening that December, and I couldn't afford to like have them go over the official like, they have this thing called like an official degree audit, which just means that they look over to make sure that you've taken all of your classes, which, like, why would I not know that I took all my classes and met all the requirements? And like, at that point, if you're having the official degree audit, like, it's just money. It's just a money grab. It's just like making us pay for like the binding on our thesis. Like, you have to pay that before you graduate. Like, okay. And then my thesis was about the artwork of people who self-harm. So I had stacks and stacks and stacks of like research that I donated to the school, and those motherfuckers didn't tell one of my colleagues, my classmates, that there was already that like research done and given to them, and even published in that fucking thing, that thesis that they kept in the fucking library, that they made us pay for the binding. All of that, they didn't tell her. She was like similar classes. So, like, if I wasn't working on this, she was the next person to work on it, So, like, you weren't gonna, you made her do all of her work when you had all of the paperwork that would have helped her? Y'all, that's fucked up. That's so fucked up. And that's what they used to do to each other. Like, they'd let you struggle. They would just, and then gaslight you. One of my other classmates was like, oh no, I went into my thesis, and she was like, so this is her story. She's like, yeah, so I went into my thesis, and they kept on telling me that I couldn't choose like the, topic that I wanted to choose. And they just kept on saying, you just like your own ideas. You just like your own ideas. Like, you told me that I should like my idea, that it would make it easier to research if I liked my idea. What do you mean I like my own idea? You like your own ideas. Like, why do I have to do your idea if I have an idea that I like that I can find research on? Like, what the actual fuck? The climate in that school has changed to my knowledge, so like they are not that big of assholes, but I will say that their Instagram is kind of piece of shit, because they'll be like, oh, this person who graduated 2 years ago, they're practicing. This person who graduated like 15 years ago, fuck them. You know, they don't reach out to us. They don't make sure that we're connected. They don't make sure that we're at those same things, being like, hey, 15 years down the fucking road, here's what you have to deal with. No, they don't want to listen to us. They don't want to talk to us. They want nothing to do with us. Like, okay, talk to the person who graduated 2 years ago who has no fucking idea what the next 10 years are going to be like. Because I can tell you, it's not going to be what you think. But they don't want to reach out to us. They don't check on us. They don't give us surveys. They don't publish any statistics as to how many of us are actually working in the field. Like, y'all ashamed of us or something? Like, you have some personal fucking vendetta? Like, what is your actual fucking problem? They'll be like, oh, yeah, no, this person graduated last year, totally got a job at where they interned, you know? Like, so that job isn't going to come available for another 20 years. So maybe the recent people who are actually in the field don't need to have that person to look up to because that job's not going to be available. Just by the way. And it might even be 30 or 40 years because that person might just like stay until they're 70. So that job, not going to be available. That agency, they're not going to want you. They already have someone. Oh, but they're going to be willing to exploit you and not pay you, though. You can get an internship there. You're just never going to get a job there because fuck you. And fuck this whole... Because fuck everyone, right? Why would you want that? Why would you want a job where you actually interned and like, new? And like, it was interesting to see the favors that people would pull for the people that, you know, were like... I would say nicer, but like not as rough around the edges as I am. A little bit like nicer and more like church going. Not that like I have a problem with church going people. I think that it's actually wonderful that they keep faith. But like, God, it's so fucking annoying when it's like, oh, this person who doesn't appear like they've had any suffering, anything, like any problems whatsoever. You want them to work with people who are severely traumatized in a program that's just starting up. Oh, and you can choose who you want for an art therapist to join that program. Yeah. I do take satisfaction, and I feel really bad about this, but I do take a little bit of satisfaction that the person who replaced the like person at this agency, who like the first person, she had been there like for this program, for this group therapy for like, I mean, she had definitely been an art therapist for like, let's say 50 years before she retired. Now she just like gardens and makes art, which is yay. But like her successor did not stay for that long. It was like, let's say it was like 5 years, maybe 8. It was not long. Which it's like, I remember having a conversation with the successor too, and she was just like, I just need to like not do this job. I can't do it. And I'm like, oh my God. Like, just like, listen, back then I thought that she had a job. She had a cushy job. She's going to stay at this organization for as long as she fucking could. And that like no one else would have that job, that she was already the successor. She already knew what the program was like. She already knew all of the members. She already knew everything that went into it. And I don't know what the fuck happened. I really don't. Like, it just, she couldn't take it as like the full director, you know, of this program. And like, I feel so sad. Like, what the fuck did she go through in however many years that like she was like, I'm not staying in this for decades like the last person, you know? Like, that for me, I'm like, ooh, what? So something happened. Something happened. And, you know, sometimes when you have to deal with like government agencies or like government funding or a whole bunch of other things that are just systemic, right? It sucks. Like, and you don't want to have to deal with it. And like it just it's a lot. It's a lot. And like there's so much that happens that just isn't addressed, you know. And like it's a lot. I don't even like, you know. But yeah, like I've been coming out and telling more of the stories to my friends, at least, of like, hey, this is how I've been traumatized by this work. And I think they're like, what? You know. And like my friend did say, well, therapists need therapists. And I was like, I was a person who was going through grad school when the psych hospital stuff happened, you know. Like I wasn't even a therapist at that point, and I had to deal with some of the most chronically ill people first. First, I am not equipped at this point in my career to even manage with those people. Like with that population, that's what we call it, population. With that population, I'm not gonna I'm not good with the population of psychosis. It is a hard very hard. Like, I think at this point, if I had to work with them, I would just be giving them resources. Here's how you get job training. Here's how you do a job assessment. Like, you need to call these people. They need to come and assess you. I will be here. The space is open for you. But like, I am gonna make sure that these people come in and they interview you, and that they figure out where your strengths are, and you get a job, or you don't. Here's disability. Let me have them come in, and they'll talk to you. Here's all of the steps that you have to take to get on disability. I'm like, I am just at the point where I would be like, I'm just giving you information, because there is absolutely, I am not equipped at this point in my career to work with that population. Like, I can't, like, I can't even think of like, what skills would I like want to teach people who have psychosis. Like, you know, like, and I was just put with that population all the time, grad school and the psych hospital, all the time, and I was expected to do well. It's not even a population I feel comfortable with now. Like, I mean, kids, totally good, like, I like turned into the cool mellow aunt, like, but back then I was not. I was trying to figure a lot of fucking shit out and navigate a whole lot of fucking shit, and like, I like, it was a lot of stress working in a toxic work environment, enough that like working with like people who are basically like reflecting the bullshit from the system that they were put in. Like, I'm with you, man. Like, this is not a good place. It's not helping you, but it's trying to help you, and I kind of see. But like, yeah, if you have to take your anger out on me, you have to take your anger out on me. It's okay, it's fine. But like, this system doesn't work for either of us. Like, it's not working for us. But like, there was a lot that I had to like, definitely move through in order to get to a place where I'm like, yeah, private practice was the best choice for me. That toxic work environment, even staying through even more turmoil, I quit before there was more turmoil. I went to private practice before there was more turmoil, and then every time I was like, I guess I have to go back, something happened and I didn't have to go back, which, yay. But yeah, I just they were in a system that was bad. I didn't know what I was doing. I had barely any skills at that point, and I'm with kids who are experiencing some very like severe mental health issues. I feel like I owe all of them an apology because yeah, no, I wasn't good. I could, like now I'm like, oh yeah, no, I'd go for a director if I could, but like I don't want to be there. We're all getting, I'm not going back. But like, like there's just stuff that it's like that was a bad work environment. Oof. And that system was awful. It was awful. And again, there's even more stuff that happened that I'm like, oh yeah, there was all that. Oh my God, there was all the other things. No acknowledgement. I just had to work. There, like, if like someone really personally had an issue with me, like I still had to face them every day. There was no, and there was no like, oh well, we could talk. No, because if I said I don't want to work with this person because that patient was really rude to my face, and this happened one time. One of the patients, he apologized. He was fine, but he had a moment where he was like, "You've never been through anything," and everyone went, "You don't know what she's been through." Mm-hmm. You don't get to tell someone that at a young age they don't have any trauma, which I was like, thank you. It's not about me. This is a projection. I get it. And he wanted to run an AA meeting. He was far along in AA that he could have done that. He did it. I had to ask. I could have said, oh no one ever said anything. Oh, I couldn't find anyone. No, I asked. He was allowed. He was a jerk to me at that point, and then he came back around and said, yeah, you probably have experienced things. I totally get it. Like, I really apologize that I even thought that. Yay. Good. But like, I still had to face that person before they apologize, and just be like, with no other support. Nothing else. Just, hey, put a smile on your face, pretend like yesterday didn't happen, and go out there. That's all that I was ever told about my job. And so after a while, I would look at myself in the mirror every day and say, all I have to do is show up. No one asks me to think. I just have to show up. I have to be present. It's all that I'm doing. And like, that helped to get me through until both my parents were like, you should leave. And like, they don't talk to each other. So like, they live in different households. They still live in different households. They lived in different households back then. But like, yeah, they were both like, something's going on and we don't want you there. So that was even more of a push to make sure that I got into private practice. But yeah, there was a whole lot of crap that happened that should not have had, like, and also one time there was a threat against my life, and there was no counseling. There's no counseling for that. And it was like a very passive threat. It was like, if I ever was walking in the woods with you, you wouldn't come back. And I'm like, well, I don't take people on walks. So to me, it was a non-threat. It wasn't anything. But again, did not get any form of support other than, we need to know who told you that was said about you by this person, because we are trying to make a case. And the person who told me didn't want to say anything, which, valid, especially if that patient's not going to get any help either, what am I supposed to do? Yeah, he said it. Okay. And really, at that point at my time there, I think it was near the end that this patient, who was a teenager, said it. And it was like, Okay. Moving on. Because what did I learn at that point? Put a face on, pretend yesterday didn't happen, don't bring any fucking pain anywhere to this work. The kids will test you, they will make you not want to do this work, which I'm like, I, I would do this work for the kids. I would. I just wasn't strong enough clinically in my clinical skills. Now I'm like, oh yeah, no, we got this. But at that time, absolutely fucking not. I totally get it. But yeah, I'm like, I don't think the kids would eat me up. I don't think they ever really tried to. Whatever issues they were facing themselves. Which, I mean, it's tough, right? Like, knowing that you have severe stuff going on or your family life is not good. Yeah, but it's a lot. Like, it is so much, and like, there are places, there's psych hospitals, and what are those called? Like, they're like psych jail facilities. I can't remember like what those are called. But it's like, they have like security, like higher security and lower security for like where the people are as far as like violence and like mental capacity, I think, probably, and mental health issues. Like, yeah. There are places, especially like the reports come out of California, don't know why, but that like one place is like, doesn't matter, it's not if you get hurt at work, when you get hurt at work. And then there was that terrible story that came out of California where psychiatric inmate found their social worker between two buildings where there was no surveillance, and he took the life of that social worker. And it like happens occasionally too, where it's just like, oh, this person was discharged. Yeah, well, they came back and like, took the life of their like therapist. And that could be anyone, anyone. And like, we're just supposed to move on, I guess. So yeah, there's a lot just in general on therapists, and like there are a lot of therapists who don't take insurances, who don't have to argue with them all the time. Currently, I am arguing with United because they had a glitch in their system and I couldn't apply it to their panel. Their website, as usual, where like I go to submit claims, perfectly fine, no issue. But like, I don't know why applying to the panel was so weird. And then what was the other one? There was something else. Oh, and then I have a client who survived 9/11, and the insurance is just not doing what other insurances are legally required to do. And I can't figure out how they keep getting around these things. Like, not notifying us with me within 30 days, which other insurances are supposed to do. Don't know why this one is aside from that. I guess federal programs get to skirt all of the everything. And there's no payment coming. Or they don't know when it might be processed. Other insurances are required by 30 days to let you know either that they have accepted the claim or that the claim wasn't accepted. And also, if they accepted the claim, pay on the claim. But federal, not allowed. I don't know. So yeah, there's and then what was the other one? Yes, there's just so I'm fighting for my clients, making sure they get coverage. sometimes the fight is a lot because there's not a lot of support still. I can't go to anyone and be like, hey, United is giving me problems. I can go to the CDC for the 9/11 claim and be like, hey, you know, this is what I understood from this conversation, but people have been wrong. And then no one has an answer when there's any wrong answer that's given. It's really weird. It's really weird. I had a situation where I was like, I called and was like, can you go by this line by line with me? And they were like, yeah, you've been paid for all of it. And I was like, I have not been paid for all of it. If you know anything about claims, you know that there's a claim date and everything that happened on that date, and then there's another claim date on a different line, and then there's another claim date on a different line, and there's another claim date on a different line. Okay? Each line has its own like payout, right? So if this one's, let's say, $400, that's not what they pay, but it's much less. But say that this one's $400, and the next one's $2, and the next one's $0, and the next one's $0. I have not been paid for 2 dates, right? Dates of service, right? Because the date of service is the line, right? How are you gonna tell me that like everything's been paid when 2 dates are paid? Like, oh no, it was processed correctly. Like, no. And they couldn't tell. I was like, this makes sense to you? Yeah, it made sense to me. I'm like, is this a recorded line? Because I want you to go back to this and be able to say what the fuck is wrong that you just said. So yeah, and then no one could give me the correct answer, and I had to send emails being like, this was actually not productive, and I didn't find anything like actually informative about this interaction. I don't want to have this conversation. Please don't respond. Basically, please don't respond to me. She was just wrong. That's not how that works. And then they just did everything incorrectly that I was like, I've never seen someone fuck up so bad. I've really never seen someone fuck up so bad. They paid me for a day where I put it in incorrectly. I accidentally put in, like, let's say it was like May 5th. I accidentally put in May 9th. And they paid on May 9th, which was the incorrect date. And then they were like, well, we have to take that money back. And I'm like, we'll process the rest of the claim because of all the claim lines that you're saying that I did, but I didn't. And they were like, well, you still have to give us the money back. And I'm like, fine, take the money out, but like, you have to give me the money back. You understand when I, like, you know, reissue the claim and I do all this other stuff. And they were like, yeah, I guess. And I was like, how did you fuck this up so bad? You paid on the day that I wasn't supposed to be paid, and all the rest of the days that I was supposed to be paid, you didn't pay. Like, you have all the information. This is actual emails that I've said, you have all the information, you need to process this claim right now. Like, I don't know why you can't. Yeah. And this is why therapists are traumatized, because how are you gonna fuck up that bad? How are you gonna fuck up that bad? Yeah, it's a lot. Anyway, I don't know if that was helpful for you. I don't know if it was helpful for me either. Anyway, I hope that you have a good day, and I will talk with you soon. All right, bye.